There are a lot of differences between open and closed rhinoplasty, and I think it's very important that patients understand the difference. So in an open rhinoplasty, there's an incision made across the bottom of the nose. The whole nose is taken apart. Everything is lifted and dismantled. So the complete structure of the nose has been invaded and taken apart. With a closed approach, there's no scar across the bottom. It's very precise. We go inside the nose and we just target what we want to change about the nose. Now, on the same token, it doesn't limit anything to do the procedure. It doesn't limit the extent that we can refine the nose. And actually in the end, because we left a lot of structure and support in place, we're able to be more aggressive with that rhinoplasty and actually get a more refined nose than with the open approach. Another difference between the procedure is going to be the recovery time. Obviously, if you're dismantling the entire nose and taking it apart, there's going to be a lot more swelling, bruising, pain, a lot more recovery time associated with the open procedure versus the closed procedure. Again, more precise, less bruising, swelling, pain, quicker recovery. So going back to work, going back to see your friends and family, much quicker, about half the time as with the open approach. I think another thing about people need to think about an open versus closed approach is the amount of time you're going to spend in surgery. Because again, the closed approach or scarless approach, there is less dismantling and taking part of the nose. It's a much faster, cleaner, quicker, more precise surgery, so the operating time is much less. What does that mean for you? A safer surgery, much less time under anesthesia, much less drugs in your system, waking up faster, feeling better, quicker. So overall, the surgery is more precise. I think more predictable because again, with less swelling, there's less scarring, less room for error. And I think in the end, the results are just superior. So for me, a procedure that the scarless closed approach is a much more precise surgery, a much more predictable surgery. And overall in the end, the results are much better than the open approach. So for me, it's a win-win-win as far as what type of rhinoplasty you want to have performed. One of the common questions I get about rhinoplasty is, after patients watch videos online or on social media, they say, is it painful? And the answer is no, it's not a painful procedure. Actually, most patients have very little pain, if any pain at all. And so the reason for that is inside the nose, we're just dealing with very fine cartilage and very thin bones. So the surgery itself is not painful. And it's even less painful with a scarless or closed approach. It's much more precise, so there's much less trauma, there's much less bruising, there's much less swelling with that procedure. So most of my patients either take one or no pain pills at all after the procedure. And the other question I get a lot of is breaking the nose painful? And the answer again is no. The only reason we break noses is if we have to narrow the nose, if the nose is crooked, but in most cases it's also to line up the bones and make it much more balanced and aesthetically pleasing. And again, in those cases, there isn't much pain with the procedure. It is common for my patients to want to combine surgeries. In other words, they're already there and they're already going to be bruised and recovering from the rhinoplasty. A lot of times we want to add procedures that are going to help balance the facial features and make the overall results better. Examples would be profile balancing, where we add a chin implant along with the rhinoplasty, or facial fat grafting, where we're also rejuvenating the cheeks and the face and the lips, things that help bring harmony to the face. And I think in the end, the results are superior, but the recovery is the same. So patients like to put them together because there's only one recovery, one time off from work, one time, maybe hiding from friends for a week. So when we combine the procedures, the overall results are enhanced, but the recovery isn't any longer. I think an important point to make is that the nose is not a standalone feature on your face. In other words, there's many other features surrounding it. And so when we're looking at doing a nose surgery, we don't want to overcorrect one feature to make up for another. In other words, when we're doing the nose, we want to look at the chin and other facial features to bring everything into balance or harmony. We don't want to overcorrect the nose for a small chin and the other way around. Also, we can do things such as adding fat grafting, doing the eyes, doing the lips or the cheeks to bring all of the features into balance and harmony. In the end, make the results of the overall procedure even better. I perform a lot of rhinoplasty procedures, and I would say now it's about half and half. In other words, half is doing rhinoplasties for the first time, and the other half is fixing rhinoplasties that were done elsewhere. And I think patients coming in have some of the same concerns. I think the number one concern for most patients is, number one, don't make it worse. In other words, when you come in for rhinoplasty, people don't want to look fake or plastic or have their nose coming out looking strange or too different. So that's number one in my mind, always in my mind, making things better. Sounds simple, but that should be the first rule. The second rule is don't make things weird. And that has to do with people worried about their nose looking piggy or puggy or pinchy or overdone, because then when they go out into the real world, people know they had plastic surgery. So my second goal is to make sure it's very natural, that people think you were born with that nose. It's not a nose that was done in plastic surgery. And my third overall rule is to do some computer imaging with your face, to use that computer imaging to communicate with you. Like the old saying, a picture is worth 1,000 words. In other words, when you go into a consultation with me, I want you to be able to come out knowing what's in my brain, what am I seeing for your face, are we on the same page? And I think that's critical, again, because of all the patients that I do, the revision rhinoplasty patients aren't that they always got completely botched, but that they didn't get what they wanted. And when I ask them why, they say the doctor didn't show them pictures, didn't go over imaging with them, and wasn't able to communicate exactly what they wanted. So I make it a huge point to spend a lot of time going over photos with you, going through your own photos, doing imaging so that we can be exactly on the same page. So you know what you're not going to get with surgery. You're not going to get any of these weird, strange noses, but you also know what you are going to get, an image of what's in my brain when I go into surgery, so that you can go to surgery knowing and feeling confident that you're going to get the result that you want. One thing patients should realize about rhinoplasty is that you don't always need grafts in your nose. The real reason to put grafts in your nose is if you want a bigger nose or a stronger nose. I'd say the majority of my patients don't want a bigger nose. They want a more refined, more feminine, or more GQ looking nose, and they don't want a bigger, fatter, lumpier nose. So in general, I would say most patients don't need rib grafts, they don't need ear grafts. If you're going in for a surgery, you should keep it very simple. Do what you want and make sure that whatever you're being told makes sense to you. Another frequent question I get about noses is, should I do fillers in my nose or should I do surgery? What's the difference? And I tell patients, if they're okay with their nose getting bigger, because when you're adding filler, it can only get bigger, then go ahead and try fillers. There's no way for a filler to shrink your nose, despite what some people may try to tell you. In general, it's good at camouflaging little dents and dings, or if you have a hump on the nose or some asymmetries, it will help with that, but it will never shrink a nose. So if you want a smaller, refined nose, the solution is always some sort of a rhinoplasty. Patients coming to me that already have fillers or threads or different things inside their nose often ask me, should I dissolve this before surgery? And the answer is you can. You don't absolutely have to, because when I'm in surgery, some of the numbing solution I use, I put the enzyme in that numbing solution to dissolve the filler on the table. So I'll know right then and there what's your nose and what's not. On the other hand, if you want to do it for planning purposes, in other words, I see your real nose and what it is before we actually go into surgery, then you should dissolve it before the procedure. Of the revision rhinoplasties that I perform, I would say that over 80 to 90% were an open approach previously. I see less people that need revisions with the closed technique. I don't know if that's because the open technique is something that's taught in training and that a lot of surgeons aren't trained in the closed or scarless technique, or whether the technique itself might be slightly flawed. What I mean by that is, when doing the open technique, since the nose is completely dismantled, there's a lot of moving parts, a lot of swelling, a lot of scarring, that in long term, that procedure may be slightly less predictable than a much more precise target approach like the scarless closed approach. And as far as revisions, I would say that I do almost 95 to 100% with a closed technique for the exact same reasons. It's much more predictable, I can target things, and it's also safer. Because when patients have had an open procedure or multiple open procedures, there is a small risk of collapse of the nose or destabilizing the nose. With a closed technique, all of that is avoided. So in the end, it is a much more precise, predictable, and safe technique to use in revision rhinoplasty. With every rhinoplasty procedure I do, I'm always evaluating the breathing. Anytime we're doing a rhinoplasty surgery, we're gonna be inside the nose, and we wanna make sure that we make breathing better and not worse. So in any case, if there's any crookedness to the septum, to the nose, and or the turbiness inside the nose, we always want to address that so that the breathing in the end is improved and not made worse. Another thing that I think is important to know about rhinoplasty is a little bit about the course of the procedure. In general, my rhinoplasties are fairly quick, which is about 1.5 to 2 hours. You are under general anesthesia, and I do recommend you go to sleep for this procedure. It's not something you want to be awake for. Secondly, when you're asleep, we don't have to use a lot of local in the nose, which allows us again to see your overall anatomy better and get a better, more precise result. As far as at the end of the procedure, I do put a small splint on your nose. That splint has tapes underneath it and then it's attached to your nose. That splint stays on the nose for 1 week. I do not pack the nose unless we're doing major breathing work. That's important so that you'll be able to breathe after the procedure and not feel very stuffed up and claustrophobic. If you did happen to have packing, it would only be in for 1 day and it comes out the next morning. It's a small little sponge that comes out the nose. I think most patients are presentable 1 week after their surgery, unless they have a little bit of bruising or black eye, which they'll cover with makeup or spray tan. In general, you'll already be able to see your friends and be able to hide the fact that you had a surgery. Then the course over the next month is that you'll go through a period where the swelling will slowly be decreasing. It does take a while, but your nose will not be as big as it was before surgery, so there'll already be a change. In the end, that's kind of nice because immediately you're a little swollen, so there's less of a dramatic change. Then over the next several months, the nose is going to continue to shrink and shrink and shrink. And usually the final result is out towards 6 months to a year. So once that splint is taken off your nose at 1 week, you're allowed to shower. I want you touching the nose, blowing the nose, cleaning the nose. It's not something that you don't want to ignore because just like a stiff joint in your body or anything else, if you don't touch it, the stiffer it will get. So it's okay to touch it, put makeup on it, blow it, go out and do things. The only thing I don't want you doing is hitting the nose. Other than that, you can get back to your normal activities really quickly. Starting at about a month after surgery, if we have a little bit of swelling still in the nose, I like to teach patients how to do a nasal massage, and that helps to get the swelling, sort of like a lymphatic drainage, to get the swelling out of the nose quicker so that you're going to heal a little bit faster. One really common question patients ask me is how will I know my nose is done? How will I know when I have my final result? And the answer is everybody's a little bit different, but the way that I like to gauge it is that you will notice when you're getting close to your final nose that you're going to have good days and bad days. What does that mean? Some days it's going to look a little more swollen, or in the morning it's going to look a little more swollen. Then towards the evening it's going to look smaller because the swelling from overnight gravity has come out of the nose. Gradually over time you have more good days, less bad days, and then finally when you know you have your final nose, it'll no longer swell anymore. It won't be swollen in the morning and you're only going to have good days. It's okay to travel after your surgery. The only caveat is that you may swell in the short term while on the plane or right after getting off the plane. It won't affect your overall long-term results, but in the short term, you may look a little poofier or your nose may look a little more swollen for a short while after traveling. So I tell patients it's fine to travel, just know that you may be a little bit more swollen when you get off the plane. I think the biggest rhinoplasty icon of all time is Michael Jackson, and it's still a common question I get or concern. Patients will say, whatever you do, I don't want to look like Michael Jackson. And just so patients know, that's really difficult to do. Michael Jackson, in reality, probably had hundreds of surgeries on his face and nose, and it's something that's not going to happen to you by any qualified surgeon. And I think also remember, even in revision surgeries, it's something that would take multiple surgeries to do, and it's something you're very low risk to having done to your own nose. Since I'm frequently seeing patients from all over the world, I get a lot of questions about how will I follow up with you after my procedure. The answer is that you'll be following up with me virtually. In other words, you'll be able to contact me through social media, through email, you'll be able to send me photos. There's many different ways we can answer questions and interact with each other over the course of your recovery. Some patients also choose to fly back and forth, but there are many other means that I will be staying in communication with you directly so that we can evaluate how you're healing and how to make your recovery the smoothest and fastest possible.